Hello everyone, and welcome to this audio podcast. Synopses and around this audio podcast series, the interlobular branch. This audio podcast is part of an interlobular branch additional series, and this audio podcast as part of a storm Communicade. And this audio podcast as part of a Squadron G-Force, and this audio podcast as part of a Storm Robotics production. This audio podcast series will delve into looking at a particular and specific sort of a pediatric nephrology sort of disease or condition. Sort of pediatrics or young people and sort of adolescents, and in around adolescent in around the adolescent sort of population or age range. And this particular condition is referred to as Henoch-Schönlein Purpura or HSP. And looking at works from 2000, looking at works sort of peer-reviewed and published works from 2018, and wherein a series or this works or this audio podcast series will look at what can we learn from sort of biomedical and clinical anatomy practice on this multidisciplinary disease, and so the synopses in around this is as thus. So Henoch-Schönlein Purpura or HSP is perhaps one of the most common vasculitis conditions in pediatrics or young people, characterized by a triad of symptomologies. Number one, a palpable purpura without thrombocytopenia. Number two, abdominal pain and three arthritis arthritis symptomology. A renal involvement or kidney involvement or excuse me also often occurs in pediatrics and young people with HSP. And Henoch-Schönlein Purpura HSP again is perhaps amongst being one of the most common vasculitis sort of conditions in pediatrics and young people. The incidence of HSP is occurs in around 8 to 20, or just over 20 per 100,000 children or young people per year. In around this sort of epidemiology, sort of HSP usually occurs in the age range between 2 years of age and 10 years of age, with around 50% of all cases occurring in pediatrics and young people age younger than 5 years, mostly in pediatrics or young people aged specifically around 4 to 6 years, and occurs more frequently in young people from male backgrounds. Although it is generally a self-limiting condition, HSP can cause renal manifestations with various indices. The guidelines and treatment for managing care in HSP patients ranges between nephrology centers and units. In around the aims of this works, around the aims of this series or this edition, number one, to provide a practical understanding of HSP. Number two, highlight the importance of the multidisciplinary laboratory, multidisciplinary laboratory practice for patients or young people with HSP, and three sort of highlight what laboratory practices could be enhanced to support the development of HSP guidelines. In around the practice aspects of this works, HSP is generally a multi-specialty disease wherein a recipient's care plan will have laboratory involvement from a variety of disciplines or specialties. Laboratory investigations suggest that HSP is not a self-limited disease, not a limited disease in some aspects, but at the same time, wherein patients eventually, unfortunately, go on to developing chronic kidney disease, or CKD. In around the sort of research stance around this works, in sort of a retrospective investigation of around 141 recipients or patients with HSP, there was works that demonstrated or highlighted that abdominal pain was not relating to HSP nephritis or HSPN. However, in around just over 40% of the patients or recipients were complicated had complicated conditions or additional healthcare indices, and in around the implications of the other complications or health complications. They implicated towards the impact of HSP in recipients. Multidisciplinary laboratory perspectives are paramount in the disease follow-up and to help inform clinical decision making. In around the sort of conclusions of this works, or part of the works, is that evidence informs the male gender, age greater than 10 years of age, have symptoms or have symptomologies of severe gastrointestinal involvement, arthritis, arthalgia, and one of the questions that come that is part of this audio podcast is what can we learn from the multidisciplinary disease. So certainly well designed and conventionally reported investigations in histology, microbiology, and hematology laboratory collaborations are important to identify HSP disease development and progression. Certain terminologies that can be utilized to identify similar regarding works include Henoch-Schönlein Purpura, HSP, hematology, anatomy, histology, microbiology, and renal. That draws this audio podcast to a close. This audio podcast, as part of a Synopsis, as part of the Interlobular branch edition or Interlobular branch series. This audio podcast as part of a SZtorm Communicade, and this audio podcast as part of a Squadron G-Force, and this audio podcast as part of a SZtorm Robotics production.